Bismillahirrahmanirrahim. Assalamu alaikum, doctors. My name is Mohammad Asim Hussain, working as product manager in Genix Pharmaceutical. Dear doctors, I want to start this session with the recitation of Holy Quran. Bismillahirrahmanirrahim. Qul huwallahu ahad, Allahu samad, lam yalid, wa lam yulad, wa lam yakul lahu kufuwan ahad. Sadaqallahu azim. Dear doctors, welcome in webinar session on behalf of Genix Pharmaceutical Management. Genix Pharma was founded in the year 2004. We have vision to help and provide top quality and affordable medicine for all those in need. Genix is being one of the fastest growing company in Pakistan pharmaceutical arena. We remain committed to improving the lives of people associated with us at all levels because we are dedicated to good health. Today, our session is a part of educational activity and presentation topic is very unique. That is use of pregabalin as anxiolytic and neuropathic pain, presented by a well-known consultant physician and diabetologist, Dr. Farrukh Naz Salawat. Dr. Farrukh Naz Salawat, consultant diabetologist in Hyderabad. She is very busy person professionally, but always available for education. Thank you so much, ma'am, to join us. Dear doctor, if there is any query, please drop your question in chat box. Question answer will session will be after session. Over to you, madam.
Thank you. Today we will discuss about the more familiar drug, pregabalin. You all know about the pregabalin. Pregabalin has a different advantages, and it is used nowadays in different conditions and diseases. Learn about the pregabalin. Pregabalin is used as an anticonvulsant or anti-epileptic medication. It is also used in anxiety disorder. It belongs to a class. It belongs to a class of medication known as anticonvulsant and anti-epileptic. Now the question is that how it works as an anticonvulsant and anti-epileptic drug. In epilepsy, it stops the seizure by reducing the abnormal signal activity in the brain. Means it acts centrally. It is blocks the abnormal electrical activity within the neurons. So in this way, it acts as an anti-epileptic or anti-seizure drug. Number two, it is also useful to treat pain. Now, question is, what is neuropathic pain? When you all arise from the somatosensory system, where the nerves are involved. So basically, post-herpetic neuralgia, trigeminal neuralgia, and fibromyalgia. These are the common disorder where the pregabalin it is also used as an anxiety disorder. And how it works in anxiety disorder, basically it from the brain. So in this way, it works as an anxiety disorder. It is also in both, and it is work in both generalized anxiety disorder as well as social anxiety disorder. So there are multiple disorder in which pregabalin works. Number one, as we have epileptic drug, and third is anxiety disorder. These are the common conditions where the pregabalin is used commonly. Now come to the slide where we have left. It is about the neuropathic pain. Okay, it is first time approved by FDA in 2004 as a neuropathic pain treatment, as well as treatment of epilepsy. Beside these FDA-approved conditions in which it is used, it is also used in some other conditions like generalized anxiety disorder, social anxiety disorder, bipolar disorder. Sometimes in insomnia, we are also giving this drug, and chronic pruritus, chronic cough. Uh, Actually, sometimes chronic pruritus, chronic cough associated with anxiety disorder. So it also work as a in chronic pruritus and chronic cough. So commonly it is used in diabetic neuropathy, fibromyalgia, and epileptic seizures. Now, the mechanism of action as an anxiolytic drug, we have already discussed. For anxiety disorder, pregabalin is approved for the treatment of anxiety disorder. It acts by voltage-gated calcium channel. It blocks the voltage-gated calcium channel and reduces the release of neurotransmitter, which are responsible for the anxiety. So by decreasing the release of or secretion of the neurotransmitter, in this way it acts in anxiety disorder. Efficacy. Now we will discuss about the efficacy and clinical studies of the pregabalin. Pregabalin, usually it is lowest possible dose of the pregabalin is the 50 milligram, 25 milligram per day, and the maximum doses can be reached up to the 600 milligram per day. It depends on the condition and patient's response. If we are talking about the generalized anxiety disorder or social anxiety disorder, where the drug doses could be 50 to 300 milligram per deciliter. It has, in high doses, it has some side effects like dizziness, somnolence, and difficulty in concentration, memory impairment. And sometimes it causes in rarely, very rarely, it causes swelling in the extremities such as hands and feet. And weight gain is also noticed with the pregabalin in persons who are taking pregabalin for long term. They also notice weight gain. It also causes dry mouth, constipation, nausea, blurred vision because of its anticholinergic effect. Okay, when we compare the pregabalin with the benzodiazepine, now the question is why we are comparing pregabalin with the benzodiazepine. Number one reason is that pregabalin is used as an anxiety disorder. Benzodiazepine are also used in anxiety disorder, but benzodiazepine have a risk of tolerance and increased risk of tolerance, while the pregabalin has, it is not it has a not risk of tolerance, but it is benzodiazepine on other hand, they are considered as a first line treatment of anxiety, but pregabalin is not considered as a first line treatment of anxiety, but also used in anxiety because of its, as we have already discussed, because of its effect, which we block the neurotransmitter release. And benzodiazepine also have a dependence or withdrawal effect, while pregabalin has no dependence or withdrawal effect. Let's we discuss about the neuropathic pain. Neuropathic pain, we all know neuropathic pain, it is usually developed after, when the disease affect the somatosensory system, while nociceptive pain is produced by direct damage to the tissues where the nerves are stimulated. Means that there are two reasons of for the development of neuropathic pain. One is the effect on the somatosensory system. Another is the direct damage to the tissues which affect on or they stimulate the nerves. So, common disorder where the neuropathic pain occur, these are the diabetes in diabetic neuropathy, herpes zoster, and trigeminal neuralgia. These neuropathic pains are basically give good response to the pregabalin. Even low doses to higher doses depend on the response to the patients. One thing more, it also useful in the treatment of fibromyalgia. Fibromyalgia basically associated with anxiety or depression diseases. So it has a good effect on the fibromyalgia. Fibromyalgia, these are the non-specific pains patient is feeling within the body, and so it gave good results in release of fibromyalgia. The pain is often, now what is the neuropathic pain and what the patient feeling in neuropathic pain basically it is a burning in type. Sometimes it is electric shock like and sharp pain, and sometimes tingling. It is because of the uh, paresthesia, hyperparesthesia of the nerve fibers. So patient feelings these types of pains, and patient belief and perception of the pain it causes, mood changes, disturbed sleep, anxiety disorder, depression. So it gave good result in relieve these symptoms. Which now we will discuss about the mechanism of action of pregabalin, which we have already discussed. Pregabalin exerts its analgesic effects in neuropathic pain through the calcium channel activity, which we have already discussed, and it has an indication in post-herpetic neuralgia, fibromyalgia, and other neuropathic pain syndrome like trigeminal neuralgia. The maximum doses we can go up to 600 milligram for the relief of neuropathic pain. Minimum dose is 50 milligram once a day or thrice a day, and maximum dose we can go up to 600 milligram for the relief of neuropathic pain. In high doses, patients sometimes notice multiple side effects, which we have already discussed. Initial doses in epilepsy, it usually 150 milligrams per day in 2 or 3 divided doses, but it can go also higher up to 600 milligram. It is also given in pediatric doses. The initial dose is 2.5 milligram per kilogram of the body weight. 2.5 to 3.5 milligram per kilogram of the body weight we can prescribe in children. Now we will discuss some guidelines in diabetes, pregabalin guidelines in diabetes. American Diabetic Association, ADA, the ADA Standards of Medicine Diabetes provides recommendation for the management of diabetic neuropathy, diabetic complication including neuropathy. While the guidelines mention pregabalin, it is the number one choice for the treatment of the neuropathic pain in diabetes. Besides pregabalin, other drugs are also used in diabetes, like gabapentin, duloxetine for the treatment of the neuropathy. But the choice of medication depends on individual patients' characteristics and preferences. But nowadays, pregabalin is the number one choice for the treatment of the diabetic neuropathy because of its minimum side effects and uh, uh, easily palatable, and uh, uh, decrease risk of and reduce risk of tolerance. European Federation Neurological Society also approved this drug as a good choice for the treatment of neuropathy. They are also considering pregabalin as a first line of drug in the diabetic neuropathy. Thank you.
Thank you so much, madam, for a wonderful your presentation. And I hope all participants and doctors enjoyed very well. Madam, we have some question in chat box. First one question is, we have the pregabalin, loxetine, and lacosamide. All of them prescribed for neuropathic pain.
Yes, they all are used in the treatment of neuropathic pain. Pregabalin, duloxetine, lacosamide, of course, they all are used in neuropathic pain. We will
But
prescribe. But
based on your
pregabalin is the number one choice because of its low side effect profile.
okay, madam. Based upon your clinical experience, which one is fast acting in pain reduction?
I have a good clinical experience with the pregabalin because it gave good result even in low doses as compared to the lacosamide, which is sometimes it requires high doses. So in high doses, patient have side effect as compared to the in lower possible doses. So where the drug dose is low and in low doses, good bioavailability with the pregabalin. So pregabalin, it is the better choice as compared to the lacosamide, which required in higher doses as compared to the pregabalin. So my preferable choice is pregabalin uh, in my clinical practice.
Thank you so much, madam,
Or
for your.
sometimes I'm also giving in combination with lacosamide where the patient response is poor or patient is resistant. So I also gave dual lacosamide.
Madam, thank you so much. Do all of the calcium channel blocker drugs works as a neuropathic pain?
Calcium channel blocker drugs actually they they are not used in as a neuropathic in neuropathic pain reliever because they have not effect in centrally acting. These are not centrally acting. Basically, pregabalin is the centrally acting, and it blocks the calcium voltage gated calcium channels within the brain. Calcium channel blockers not blocking voltage gated calcium channels in the brain. Pregabalin is centrally acting, so it really give better relief in pain management.
Thank you so much, madam, for your wonderful presentation. And I hope you will also available in next presentation, madam. And just we close the session. Thank you so much, madam, for your time. Thank you so much.